We are back now with our town hall special as we look at the impact of the Delta variant on Western New York. You know, you wish that it didn't have to be this way, but often the strongest message about getting vaccinated can come from someone who regrets not getting vaccinated.
Yeah, Two on Your Side recently talked to a patient from Niagara Falls while she was in the hospital. She was pretty frank about it. She wishes she could turn back time to before she got the coronavirus so that she could have gotten those shots.
I'm going to tell them the truth to go ahead and get vaccinated. Everybody have a mind of their own and they have choices in life. That's up to them. That's up to them. I had my choice when I didn't do it, but now I see the consequences and behind it. And it taught me something. It taught me well. Yes, it taught me.
And your heart breaks when you see that. And thankfully, Ms. McCall is doing better. She's now out of the hospital. She's recovering. But we want to talk about vaccines now with you. And Dr. Orellana, you serve a minority community, and we know that healthcare access can often be a problem. Are we seeing any of that? And what is being done to make sure that it's really easy for people to get their vaccination if they want it?
Yes, absolutely. At our clinic, we have the ability to have patients vaccinated. Right next door, we have the pharmacy, and they can walk in, see us for our initial visit, and come right over to the pharmacy and get vaccinated for sure. A lot of it is patients don't even know where to go to get vaccinated. So definitely coming to Sisters Health Center and seeing your primary, seeing one of us will definitely help us, and we can guide you as to where to go about, how to get it done, how often you have to get your shots, or space them out or schedule it. So it's definitely something that we're reaching out to the community as well, and inviting the community to come in and be seen. Some of these patients haven't been seen by a primary in decades, so they have no idea where to go or for any guidance. So most definitely we have access to vaccines in our clinic, or at least some guidance as to where to go to get your vaccines, COVID-19 vaccines for sure.
Yeah, definitely good to hear that. Dr. Turkovich, we mentioned how kids under the age of 12 aren't yet eligible to get the vaccine. I wonder if you can update us on that. I know at some point we expect that it's going to be approved for those younger kids. And then what would be the message to parents who either haven't had their kids older than 12 or 12 and older vaccinated, or who maybe say when it's available for the younger ones, they're not going to do it?
Yeah, so the update is that the FDA is expected to get some of the data from Pfizer likely in September sometime, hopefully mid to late September. Once they get that data, then they'll be able to review it, and we're hoping that sometime in October, November, they'll approve it. And if that's the case, then by early December, we should be able to have vaccinations for children. We're thinking it's going to be 5 and above. And then after that, it will be 6 months to 5 years, likely by the beginning of next year. But I think it's really important for people to talk to their pediatricians about their concerns, because they really have that relationship with them. I would say personally, I'm going to get my children vaccinated when they are eligible. I do understand the fears that they have, but we have seen the negative effects of COVID. And the one thing that worries me the most about COVID is the unknown long-term side effects of the disease. And we know that sometimes 10 to 20% of children who have had COVID will go on to develop long COVID syndrome. And those are some kids who had no pre-existing conditions. And I certainly wouldn't want that to happen to my child. We know that it's safe, it's studied very well. And so I think it's important to get your child vaccinated, but if you have concerns, talk to your pediatrician.
This is really such an opportunity for you to be able to speak to the people of Western New York. And Dr. Shiley, this question is for you. You're an infectious disease expert, and you've probably heard this. I know we've heard this a lot, but people saying, I'm healthy. If I get COVID, I'll be fine. So why should I bother with getting the shot? How do you respond to that?
It's a great question, and I think it's a common thought for a lot of people. They're generally healthy, they feel fine, they know people that have had COVID and recovered without too much of a problem, although certainly we know a lot of people that have had longer term symptoms despite not necessarily being in the hospital. There's a few things I would say to that. The first is that we can't always predict who is going to become ill. Yes, we do know people with pre-existing conditions are more likely to have severe illness, but we definitely have seen people that otherwise are generally healthy get very, very ill, including end up in the ICU. On top of that, I always ask people, what's the worst thing that can happen to you personally? The common answer is, I could die. And the next question is, well, what if you gave it to someone else and then they died, such as a family member or someone else you love? So there's more than just the person that becomes ill. It's the person around, the people around that person, et cetera, et cetera. And when you think about all of the people that you know in your community, a lot of those people may not have even been able to get vaccinated, children under 12, for example. And there might be some people that for various medical conditions just don't respond as well to a vaccine, and you might be around them. We have to protect ourselves, but we really have to protect the people around us too. This is our community.
Yeah, absolutely. Finally, Dr. Cloud, and we're going a little bit long here, so I ask you to be brief. There are hospital workers and nursing home workers who are going to soon be required to be vaccinated, who also haven't and don't want to. What do you say to them?
Well, I think we have a safe vaccine that can really offer protection for your patients. So I think it's really important for people working in a healthcare environment to be vaccinated so that we don't put the people who have chronic medical conditions, put their lives at risk.
Yeah. Thank you all.
We're so grateful again to have your insight. We want to mention as well that you're from 4 different healthcare organizations in Western New York. So for you to come together, because you are in a way competitors, but also uniting for such an important reason tonight. So we thank you for that.
Yeah, it really does speak to the importance of this conversation. Thank you.